Hello everyone, my name is Dr. Drsolanki. I am a cataract and refractive surgeon. In today's video, I will be discussing with you all about cataract. So when we go about cataract, we should know what a normal eye or what a normal lens is. So when you see this is a normal structure of the eye. Okay, the front part, which is the most clear structure, is called as a cornea. The second, which is the most clear structure within the eye, is called as a lens, which is naturally available and which is very clear. The third major part is the nerve inside the eye, called as the retina. Now when these three structures are in the eye, your vision is clear. With age, what happens is your lens inside the eye, that's the natural crystalline lens, which should be transparent, starts becoming a bit opaque. It starts changing its color, initially to a bit yellowish, then a bit amber color. Then as time progresses, if it becomes more progressive, it may become brown, and then it becomes white or black. Depending upon the grading or type of the cataract, the vision can be correlatively lesser. So with age, this is a natural change. Generally, we see that the cataract progresses after the age of 50 to 60 years of age. It can be earlier also, but majority of the times, about 90 to 95% times, you see or we see cataract generally after 55 to 60 years. In these generations today, we also see cataracts at the age of 20 years, 30 years, 40 years, or even by birth or neonatal age group. In this video, we will not go the types of ages caused etiology, but I'll be talking mainly about the cataract causes in general and what are the features or the vision that can be happening in cataract. Surgical or the outcomes or the management of this will be another separate video. So in this, what happens is when the age goes on or when the cataract inside the eye starts developing, the lens starts changing its color. Now as you see this is a natural lens which is very clear. It's like a transparent glass which helps you to see through and through. Okay? It's just like a windshield glass of your car which is very clear. Be it day or in night, the light passes through easily and you can see clearly. With age, the tissue inside the lens starts changing its consistency, mainly the proteins. This causes a structural change within the tissue of the lens. So initially what happens, it can become a bit whitish and you can see in between, or it can also become a bit grayish, yellowish or white. Now when this type of lens happens, it becomes really blurry, difficult to see, and there would be symptoms of diminution of vision. So initial stages, how would the vision be generally? Initially, the patient or the person can see blurriness of vision. He can or she can have double vision because the light spreads or scatters. So you might see two visions or two images next to each other. They might see splaying of light, in the sense at night when you see like a tail lamp of a car or a headlight of a car, the lights are not circle, they'll be like splaying out. Okay, they'll be like one horizontal line more than the other. It can also be that when you see a light at night, like headlamps, or a bulb of a home which is in home, it can give halos, means it be spreading out in nature. Okay, it can also cause color or contrast sensitivity. Why? Because when the light passes through this semi-opaque or translucent media, the vision, the light decreases its intensity, and this causes a contrast change in your or color change in your vision. This can happen altogether or in combinations of each other based on the type of cataract and the staging of the cataract. Cataracts are of different type. It can be either the front part, which is called as anterior. It can be the middle part, which is more commoner in elderlies, called as a nuclear cataract. It can be also the posterior part, behind part of the lens, which is called as the posterior subcapsular cataract, which is generally seen in diabetics, young age group people, or in other eye problems which are seen inside the eye, maybe retinal problems or any other problems. So when this happens, the vision actually starts coming down. Now the main use of the eye is only one, to have you clear vision. Now if this starts coming down, the vision comes down, the vitality of the person also starts coming down. So initially, if it is an early stage of cataract, when you have a checkup with your doctor, this sometimes can be improved. I mean, the vision can be improved with glasses. Now if it's an early stage, we ask them to just have a visit after 3 months or 6 months based on the grading or staging and the type of cataract. And if the vision is improved with glasses, it can be continued. This generally is in the early or initial type of cataracts. When it progresses, which generally will progress in everyone, okay, how fast, no one can gauge it, because sometimes it may take years to get to the progress, sometimes it within few weeks or few months. So that depends on type of cataract and also any other problems or illnesses which you have, like diabetes, hypertension, or any other internal issues which you have, or any other injury in the eye. Those are also can be one of the causes of cataracts. So when the cataract progresses, naturally the vision starts coming down. You get disturbed vision, and your vision becomes low, so your work also starts coming down. The vitality of the work or this comes down. So this becomes more problematic when the light around your surroundings come down. To give an example, in the daylight when you're outside, there's a bright sun. So even if there is a moderate form of cataract, you can still manage, because that light, bright light which is there around the surroundings due to the sunlight, gives you some extra advantage. But when you're inside the house, when there is a dim light, or at night when the sunlight is not there, there is a diminution of light, and hence that causes more deprivation of light inside the eye, and that causes more blurriness of vision or dimness of vision. During that time, you really have to struggle to have a clarity of vision, specifically for the small objects, like if you're writing, if you're watching television, and if you're seeing the scrolls for down, for example, a match or cricket match or football is going on, and you need to see the scrolls, the scoreboard, or when you're seeing a news channel, the headlines which are going down, that becomes difficult. Now this becomes irritable for the person also. So when this staging of cataract comes, do visit your doctor, and then we will tell you how to go forward. The cataracts are more significant, then surgery is imminent. As I told you, in the initial form, glasses may help you out, but ultimately this will go into surgery. Surgery is the only definitive treatment for a cataract. Now, based on the type of cataract, the surgery can also be proposed. There are basically two major types of surgeries. One is the manual surgery. The second one is the laser surgery or machine surgery. I would put it as a machine surgery. So in manual surgery, what we do is, let's say this is the part of the eye. We make a cut throughout the white part near the cornea. This would be around 7 to 7.5 millimeters. Okay. Then we go inside. We make a nick in the cataract, remove the lens inside, which is opaque, and then in that place we implant an artificial lens. So this kind of cataract surgery is called as a SICS, or small incision cataract surgery. Previous to this, in maybe 20 years back, we used to do something called as an ECC, which is totally abandoned now. Unless until required, we don't do this. Now the next type of surgery is called as a machine surgeries. Here again there are three types. First is the phacoemulsification surgery. Second is the MIS surgery called as micro incision cataract surgery. The third is a laser surgery called as a femtosecond laser cataract surgery. This what we do is, I will tell about first the phacoemulsification. wherein with the help of a machine, we go inside the eye, making a nick of about 0.8 to 3.2 millimeters only. Go inside the eye, we break the cataract inside into small bits and pieces, and then this is sucked out from the eye, and in this place we implant an artificial lens like this, okay, inside the eye. Now the second one is MICS, which is a micro incision cataract surgery. It's kind of a similar one, but the incision which is made is even smaller. It can be on, as it is on an average, 2.2 millimeters only. And go inside the eye with the help of a machine. We break the lens particles into small bits and pieces, and then this is sucked out from the eye. And then again in that place we implant an artificial lens inside the eye, which is basically an acrylic material, which is a medical grade plastic, and that is implanted inside the eye. The third variety is called as a femtolaser assisted cataract surgery. Now remember, as I told you, it is an assisted. So in that, what we do is, with the help of another machine called as a femtolaser machine, we make small incision in the cornea, and also the opening of the cataract is made through that, and the lens is broken into small pieces. So in that, then after that, an MICS machine, that, as I told you, the handpiece that goes inside the eye, breaks the cataract, and then that sucks out the cataract from the eye. And then again in that place we place the artificial lens. So all these three are good, there's no doubt in that. One has an advantage of the other because there is a difference in small slight procedure time. World over, most operated type of cataract surgery is the MICS or micro incision cataract surgery. About 90 to 95% of people globally opt for an MICS type of cataract surgery, and also most of the surgeons are comfortable doing that. Now the major differences between the manual and the machine surgery I have told. Now this is related to technique in very small gist. So what are the outcomes? So basically manual small incision cataract surgery or SICS is now almost not done because the recovery period is very long. To make a cut, so the bleeding is more. The type of lens which is given in that is a glass lens or a plastic lens, which is a bit different, and these are non-foldable lenses. They have a very limited type of outcome, hence there might be some other post-operative limitations in them. I would not say it's complication, but it is a limitations. These kind of surgeries are generally done only if the cataract inside the eye is very hard, or there are other predisposing factors in the eye with cataract, like there is a very small pupil, or there is any injury or trauma in the eye, or any other supporting of the lenses, which is called as zonules, are very weakened. So based on the type of cataract and the type of status inside the eye for the cataract and its support, the surgeon will decide which is advisable. The major advantages in the machine operated cataract surgeries, which phacoemulsification, microincision cataract surgery or MICS or femtolaser assisted cataract surgery, is that because the surgery is very fast, on an average takes about 5 to 7 minutes on an average to finish the surgeries. The recovery is very fast. Within a day your vision is almost back to normal. Okay, there's hardly any blood because it's a bloodless surgery. Hardly there is any blood in that. There is hardly any pain. There is no stitches which are used, unlike the previous manual surgeries. There are various options of artificial lenses which are used, which give a better outcome based on the type of lens you choose, either monofocal, intermediate, EDOF lenses, or multifocal and trifocal lenses. Okay. The other options are also, hence this gives you a better compatibility for the patient. So these machine operated surgeries or machine guided surgeries are the ones which will give you a better outcome and faster recovery and faster mobility. So these are the types of surgeries. So what happens if you delay a cataract surgery? The cataract slowly will mature on its own. Okay, the vision actually comes down. You might be able to see a very distant object that slowly comes down with increasing grading to a blurred vision. Okay, you might not be able to see even your television monitor or a screen. Later, if it progresses, you may not be able to see your mobile phones or even your reading newspaper. And if it fully matures out, the surgery it becomes difficult. Then if it still is not operated and if it's left on its own, cataract may burst inside the eye. Now this is one of the emergency situations in the eye which none of the eye doctors would want to see this, because such kind of situations, the outcomes are unpredictable. No guarantee in vision or type of surgery is advisable or can be given. The type of lens chosen are limited, okay? And the follow-up will be very long, can be painful, and there also be many other complications with the eye. So that's why when we have a checkup, if it's advisable, then we say immediately, or maybe 1 month, 3 months, 6 months, based on the type of surgery or cataract which has been told to you, so that your eye doctor will help you to guide you on that. So based on the type of cataract, you will be advised the type of surgery and the type of lens. Each one has an USP. It's not that the monofocal lenses are inferior. No, they are an excellent lenses, but there is an added advantage of the next level of lenses, like an EDOF lenses, a toric lenses, or a trifocal lenses. The details of the type of vision we get in different type of lenses, I will try to cover up in another video, because they themselves are a huge topic, and I will try to simplify them with the help of a video or a diagram in the next coming video. So in short, this is what you should know about cataract. So to break it up, or just if I to sum it up, the natural eye has a clear structure called as cornea. The next internal clear structure called as the lens, and the nerve of the eye, which is the retina. With age, this will become opaque, and this opacification of the natural lens is called as cataract. This will cause decreased vision, blurriness, double vision, color change, or contrast change. Either of this or in combination of this. Initially, you can use glasses to improve if possible. If not, surgery is the only option. Based on the type of cataract, your surgeon will advise you the type of surgery, and with the type of surgery, he'll also advise you based the type of lens to be chosen for your eye. So this is what about cataract. So one last point which I would say is, the surgery happens once a lifetime, okay, and we would want to do the best possible procedures for you, for your eyes, so that you can get a better outcome and the longevity of the procedure. So in this is what cataract is from our side. Thank you.